Ready? What's my scenario?
Gunshot wound to the right chest.
Makes it easy. All right. What's our patient's age?
38.
All right. So we have a 38-year-old male with a GSW to the chest. All right. So I'm going to start the station. My BSI is on. I'm making sure that the scene is safe. My mechanism of injury is a GSW. I appear to have one patient. I'm going to call for ALS. And because it's a trauma, I'm going to have my partner hold C-spine in a neutral line position. Do not let go. My general impression is a male patient lying on the ground, supine. I'm going to assess for responsiveness. Is the patient alert when I walk in the room? I'll take your silence as a no. Sir, can you hear me? Do painful stimuli. This patient's unresponsive. Chief complaint is unknown at this time. I'm going to expose my patient from head to toe. Looking for any apparent life threats. That would include arterial bleeding, a sunken chest wound, any other issues. My glove is stuck. All right, so I expose the patient. What do I find?
You find a gunshot wound to the upper left chest.
Okay. So I have a GSW to the upper left chest. Appears to be a sucking chest wound, bubbling, gurgling. So what we're going to do is apply an occlusive dressing on the patient's chest. Go over to my bag, look for So we would apply an occlusive dressing to the right side of the chest. We're going to tape it on 3 sides, creating a flutter valve. Is my intervention adequate?
Yes.
Okay. So at this point, I'm going to open my patient's airway using the jaw thrust maneuver. I'm going to make sure that the airway is clear. Then I'm going to measure and insert an OPA. I'm going to measure from the corner of the mouth to the tip of the ear. I'm going to insert, tip towards the roof of the mouth, rotate it 180 degrees. Does my patient accept?
Yes.
I'm going to assess respiratory rate. I'm going to look at the chest for equal bilateral chest rise and fall. What's my respiratory rate?
60.
All right, so it's going to have a elevated respiratory rate. We're going to hook up BBM for O2 tank. Make sure the tank is on. We're going to set it to 50 liters per minute, 100% oxygen. Lay the tank down. My partner can hold C-spine with his legs. And he's going to ventilate this patient 1 breath every 5 to 6 seconds, providing rescue breaths. Is my oxygen ventilation adequate?
Yes.
Good. Circulation, we're going to check for our carotid pulse. Ask the proctor what the pulse is.
160.
Okay, so we have a pulse rate of 160. We're going to note it. I'm going to check the patient's skin, color, temp, condition. I can put my forehead on the top of his head. I'm going to check him all over. I'm going to assume he's pale, cool, and clammy, so we're going to treat this patient for shock. We're going to give him a blanket. We're going to keep him warm. I'm also going to check for any major bleeds.
No major bleeds.
Good. All right, this patient is a high priority transport based on a GCS of 3. Next, I need to obtain vital signs. So I'll start again with the head. Starting at the top, I'm going to check again skin color, temp, condition. Okay, we're going to come down. I'll check my patient's pupils. I'm going to check my respiratory rate. I'm assuming that my respiratory rate is whatever we're bagging the patient at. I need to obtain a blood pressure. Once you demonstrate how you would obtain a blood pressure, proctor should tell you what it is.
162 over 78.
162 over 78, noted. We're going to recheck the carotid pulse. All right, still rapid at a rate of 160. All right, I'm going to send my partner for a sample history, and now we're going to start our secondary assessment. So starting with the head, I'm going to check for decap, BTLS, and crepitation. I'm going to check the top of the head, front of the head, sides of the head, back of the head. for deformities, contusions, abrasions, punctures and penetrations, tenderness, lacerations, and swelling. Is there any blood on my gloves?
No.
Negative.
Okay, we'll check the face, around the eyes, the maxilla, the mandible. We're going to check behind the ears for any bruising, battle signs. We're going to check around the eyes for any raccoon eyes. We'll check the pupils, make sure they're equal and reactive. We're going to look for any blood from the ears, the eyes, the nose. We're going to check the ears for any CSF. Anything noted?
No.
No.
Okay, we'll reconfirm that our oxygenation is adequate. We're going to come down and check the neck for decap BTLS crepitation. Going to check for any step-offs behind the neck. We're going to look for tracheal deviation and jugular vein distension. Any blood on my gloves?
No.
Checking the shoulders for decap BTLS crepitation. Any blood on my gloves?
No.
We're going to check the clavicles and we're going to check the chest for decap BTLS and crepitation. We're checking the ribs for flail segments. We're going to look for any paradoxical motion or uneven chest rise. We're going to check the sternum using a chopping motion. Okay, I'm also going to keep in mind the injury that I have here, and I'm going to confirm that my occlusive is still adequate. We also need to auscultate for lung sounds in 6 positions. I check the right and the left just below the clavicles. The left and the right and the left, just below the nipple line, and we're going to check mid-axillary. We're going to check the abdomen for decap BTLS, distension, and rigidity. Going to check the upper right quadrant, upper left, lower right, and we're going to check the bladder. Anything noted?
No.
No.
Check the patient's right arm for decap BTLS crepitation, checking for pulse. Motor, I'll ask the patient to wiggle his fingers. Sensory, I'll squeeze and ask to see if the patient can feel it. Come down, check the right leg for decap BTLS crepitation, check for pulse. Motor, I'm going to ask the patient to wiggle his toes. Sensory, can the patient feel me squeezing? Walk around my patient, check the patient's left arm for decap BTLS crepitation. I'll check for pulse. Motor, I'll ask the patient if he can wiggle. Sensory, if he can feel me squeezing. Patient left leg for decap BTLS crepitation, check for pulse. Motor, can the patient wiggle his toes? Can he feel me squeezing? One of the things I forgot to check was the pelvis, so we check the pelvis using an in and down motion. I also do a genital sweep, looking for priapism in males, hemorrhaging in females. Next thing we need to do is lag roll the patient, so we're going to lag roll him on his uninjured side. Someone want to help me lag roll? Alright, so we're going to lag roll the patient on C-spines count. Alright. Ready? 3, 2, 1. Lag roll the patient. We're going to check the patient for decap BTLS crepitation. Checking the head, back of the neck. We're going to check the thorax. We're going to look for an exit wound. Come down, check the patient's buttocks. We're going to look for any rectal bleeding. We're going to check the back of the patient's legs. At this point, we would insert backboard. C-spines count. We'll roll the patient back.
3, 2, 1.
Okay, we secure the patient to the backboard. Middle, bottom, top, legs, head.
Secured.
Good. Then at this point, we would manage any secondary injuries if we had any.
None.
We would reassess our patient every 5 minutes because he's unstable. That's it, I'm done with the station.